The Arlington Health Department monitoring 4 people who've traveled from mainland China who are under self-quarantine. That's down from a dozen a couple of weeks ago, none showing symptoms of the new coronavirus.
The public health nurse will follow up with those individuals and check in with them a couple of times a day to make sure that they're checking their temperature and reporting any symptoms. If those individuals were to develop any kind of symptoms, we would then be contacting the Mass Department of Public Health and having that individual or those individuals contact their doctors.
On this beautiful day, the first week in March here in Arlington, it's hard to imagine that coronavirus could come here. But the local Board of Health is watching out for Arlington residents. They're preparing for any scenario just in case, including the possibility of community spread. That's where it could be spread coronavirus from person to person. They're working with the schools, they're working with the fire department and the police department. They have the power to close schools or cancel activities. It's something they wouldn't want to have to do, but are considering it just in case.
What we're telling everybody, whether it be town officials, school, our first responders, is to come up with a plan for continued operations because we may have disruption. Would there be a point where we might need to have some closures? Maybe.
It's fine with me. I think it's adequate. My feeling is this is going to spread all over the country almost regardless of what we do.
They're running through scenarios, that's good. I'm glad that they're doing that just to make sure that we're protected.
I would say a town even as small as Arlington needs to be even more prepared, since it's clear that we can't necessarily rely on what you would have thought were tried and true national resources on this front.
Arlington Public Schools taking precautions with extra cleaning and relying on people to self-report international travel from affected countries. As people look to protect themselves, wiping out shelves of cleaners and other supplies, local health officials say you may want to plan to set up a separate room in your home in which to care for a family member if they are sickened by COVID-19.
Do you maybe have an extra room or an extra bathroom that people that are ill could be utilizing, whereas the people that are healthy could be using the other rooms and the other bathroom? That's the type of preparation that we're looking for people to think about.
Officials stress this is an evolving situation and urge folks to stay tuned to the town's website and make sure you're signed up for those text, voice, and email alerts. Brenda Mahoney, ACMi News.